When it comes to containing costs in healthcare, everyone has their 2 cents to give. But what do those of us in the business of health insurance have to say? This is Health Sense, and I'm your host, attorney Adam Russo, CEO and co-founder of the Phia Group, a firm with over 25 years experience navigating this ever-changing industry. Join me and my guests as we make sense of effective ways to reduce the skyrocketing cost of healthcare while improving quality outcomes for patients. The only thing it will cost you is 30 minutes of your time. So let's get right to the bottom line and reimagine what healthcare could be. Hello, everyone, and welcome to Health Sense with me, your host with the most, Adam Russo, the show that gets right to the bottom line on ways to reduce healthcare costs while improving quality outcomes for patients. As I always say, the main problem with healthcare in America can be tied to Einstein's definition of insanity, doing the same thing over and over again, expecting a different result. Yes, folks, that is our current healthcare system. And if you went through renewals in January, as most of you did, you'll know that what I'm saying is exactly the truth. Our word of the day is surprise, as promised. And I'm really pumped about this. Today is part one of our special 5-part series on costly care, why healthcare is so expensive. We're going to get into the nitty-gritty. We're going to get into the stuff that you're not going to see on your local news. You're not going to see on the major websites. Heck, you won't even find this on Instagram or on X, only on Health Sense. I have a return guest. The first time we have a return guest on the show. He's special, and I've been looking forward to this series for a while now. And we'll see, because I was asked, how many of the 5-part series specials would you want Scott Bennett to be your guest on? And I go, all 5. Why wouldn't I want it for all 5? Scott Bennett, as you all know, just got promoted. He is now the Chief Provider Relations Officer at the Phia Group. We're very excited by having him here. And he will talk about the new audit by the Phia Group, which has just been released recently, flagging provider billing strategies driving employer plan waste under the No Surprises Act. It is a new state-by-state analysis revealing how the NSA arbitration dynamics are fueling excessive costs for employer-sponsored health plans. Scott, thank you for joining me today. How's it going, buddy?
It's going great. Thanks for having me. And I'm really looking forward to talking about this because as more transparency occurs, this is exactly what they want us to do with it. They want us to talk about this stuff. They want us to analyze it, and they want us to see if we can improve healthcare costs by participating in the exchange of information.
I had the chance to review the audit in detail, and it's amazing the amount of detail and information that has been found, in particular on certain states really being the red hot areas of just abusive practices by certain providers. And it's not all providers. I mean, what your report even found was how certain providers in certain parts of the country are really taking advantage of loopholes or certain strategies to really drive up costs across the country in many ways. So first, if you wouldn't mind telling us, how can our listeners get access to this amazing audit created by the Phia Group?
Right. And the best place is probably if you go to the Phia Group's website, there's an announcement that presents the information and talks about where it is. But there's also press releases that are out that identify the audit and the data behind it. And the data behind it is important to say. Anyone can also go and get the underlying data. It's public record as well. So you've got this extremely large amount of data, but then there's these analysis on the data. And our analysis is one of a few. It covers a different aspect and context, but there are a couple groups I would recommend that looking at the entire cornucopia of analysis that are coming out is really important. Ours is a very good one as a start.
So, folks, for those of you who want a quick understanding and analysis of the Phia Group's findings, check out our website, as Scott said. But if you want that cornucopia of knowledge, we will also has links to other reports and where you can find this information if you want to dissect it for yourself. Thank you, Scott. So first, the word of the day was surprise, right? Obviously talking about the No Surprises Act. So can you explain to our listeners how the No Surprises Act independent dispute resolution process, as we call it, the IDR process, how it works and why it was supposed to protect patients when it was first created?
Yes, and protecting patients was the focus. That's a good start. And a lot of people, especially individuals that see it, think this is great. It erased bills because there were these bills and the bills are gone. And I think the most important thing to get from this is it didn't erase the bills and it didn't erase the cost, but it did protect patients. So the No Surprises Act was supposed to protect patients if they end up in an emergency room situation, or they have an out-of-network doctor at an in-network facility, so they wouldn't be surprised by these bills that came out later that were out of network and that they potentially could be responsible for. And so the way it works is if one of those bills occurs, then they cannot be balance billed. By law, it says you cannot balance bill for it, and the fight is moved to the plan and the hospital, or the plan and the doctor, and there's a process for that, and the process is IDR. So it has to start with negotiations. There's supposed to be a meaningful negotiation, and then after that process, there's an IDR, independent dispute resolution arbitration, and it's baseball style, meaning the provider makes one offer and the payer makes an offer, and then the IDR entity, which is a private entity that has been they've been certified as an IDR, they make the decision, they choose one of those two offers. So it's a dispute resolution process that's been built to prevent balance billing, but it doesn't erase balance bills. And I think that's where there's we're talking about healthcare costs. The healthcare costs were not erased and still exist. It's just that the risk to the patients themselves was not erased. And hopefully throughout this the episodes in these series, we can talk about how those harms are still occurring to the patients. They're just occurring in a different way. And this will be the start of that.
So what's interesting, what you just said was this did not necessarily create a fix to reduce high underlying prices. What it did was it basically took away the balance bill from the patient. Well, you
Right.
can make an argument that one of the reasons, if we didn't have the No Surprises Act, one of the reasons why there was a push to reduce costs was because patients were screaming, patients were upset. And now, by taking the patients out of the mix, if anything, the fight behind the scenes could actually drive costs higher for health plans, which in essence will increase costs to the patients in higher premiums, higher copays, and
Yep.
higher deductibles for all of their claims. Would you not agree with that?
Yes, I mean, it could have done both. It could have actually reduced costs. But in reality, what it's turned into, and it's not a great analogy, but painkillers for back pain, where it takes away the immediate pain, but the underlying issues are still there. And there are still issues that are occurring, and there still is work to be done. So I think that's the best way to look at it is it did take away what was a very, very public and very extreme kind of pain for patients, but the harm it still exists.
So let's dive into this report that the Phia Group created. And the first thing I noticed is very much like everything else at Phia, we try to make this as simple as possible for the readers to understand. You categorize each doctor, facility, hospital, we'll just call them all providers, as green, yellow, red, and purple. What
Yep.
determine those categories and what do they actually reveal in this report?
Right. So the data question, what the question we were trying to answer is all this data came out, and this time, very transparent, they're getting better. The data had the provider's NPI, national provider information. So you could see who had initiated these reports. It also showed what their offers were and how much higher their offers were than what's considered the median market or that QPA. So we had some really good information there, and we looked at two things. First, we took other CMS data, transparent data, and we looked at provider billing aggression in their own state. And that just means how high is a provider billing compared to other providers. So is this a provider who is billing $500,000 when everybody else is billing $100,000? So billing aggression was one. And then we looked at what we'll call offer aggression. So how many providers in this new data were actually making really high offers. So billing high and offering high, that sort of thing. And so to look through those colors, to go through them just real quickly, green is providers who are generally low billers and they're making lower reasonable offers in IDR. So they're really using it as a dispute resolution process. Yellow is providers who bill relatively high, but they're still making moderate offers. So even though there's a lot of issues with bill charges and how the charge masters work, and some providers have to bill high because it's part of their process and their arrangements, but they're still coming to the table for these disputes with reasonable market-based amounts. And there are, I mean, when you interview providers out there are providers and their representatives who will say, yeah, we understand nobody pays bill charges and we don't make anybody pay bill charges. And so those are still yellow providers. Red providers are the ones who have billed high, they're billing as high as they can, and then in addition, they're going in and making really high offers. So now it becomes more of a revenue strategy instead of dispute resolution. And then we've got purple providers. And purple providers are providers who are billing relatively lower. They don't bill really high, but their IDR offers are really high. And those are providers who either via working with somebody or themselves have turned this into a revenue channel or a revenue capture. Those are some of the most concerning providers. So those are what the colors represent, Adam. That's kind of what we were going for. So you could look at a heat map and see where you had these issues.
Speaking of the heat map, it looks like to me states like Nevada, South Carolina show much more aggressive patterns, while places like Michigan appear to have much lower risk. Can you share some thoughts on that, please?
Yeah, we in the report we recognized what we expected is this isn't, and you mentioned in the beginning, this isn't just high volume or an issue with some uniform problem of the process of the system. It's how the system's being utilized, and there's clustering. So there's clusters, for instance, like you said in Nevada or South Carolina, where there's a market concentration for providers and perhaps a service mix, a lot more emergency services or these kinds of services. And then the most important piece is these repeat players. Providers who are just initiating IDR as part of their collection activities, not as dispute resolution, but just as revenue capture. And that means that small groups are filing at scale. And so that's why you've got some of these clusters, like you said, where the numbers are showing a lot more purple providers and a lot more red providers.
So bottom line, it's almost this is their tactic, right? It's as
Mhm.
if we know that if we go through this IDR process, more likely than not, we're going to get a higher amount of revenue, right? Higher bill payment. So that
Right.
is part of their overall strategy. Just like, again, as an entrepreneur myself, it's a smart tactic if you're that particular facility or that provider. If you could have a process where you could take advantage of getting paid more for your services than normal until somebody catches you or somebody flags it or somebody says, hey, we got to stop this. Why wouldn't you want to keep taking advantage of that if you're on their side?
Right. And not only the individual providers, but as we'll kind of talk through, especially through all these episodes, there are certain repeat players and entities that have surfaced and turned this into a cottage industry where they're going around and convincing providers. These are those purple providers, you're billing low and you're not getting paid enough. Let us help you. Let us enhance this process and capture more money for you.
Perfect. Now, what I also noticed is when I looked at some other states, is a state like Tennessee has a high number of disputes from a relatively small number of providers. As an employer, a self-funded employer myself, what should I and other employers like us take from that, what's happening in
Yeah.
Tennessee?
Yeah, what you really want to take from it is, and you hear people say almost in a defeatist way, these employers will say, the NSA is just what it is. We're getting these determinations. We're losing a lot. They're just collecting. It's just kind of this inherent, unavoidable background noise that's happening. But seeing a state like Tennessee, where a very small number of providers are repeatedly filing over and over again, shows you that that isn't a widespread problem. It's a problem with specific patterns and specific services. So as an employer, what you want to do is you want to be more strategic instead of reactive. You want to make sure that you identify those patterns of those providers, that you identify where the repeat providers are, where the repeat codes are, who the filing entities are, and you have a targeted strategy to contain costs instead of, and this is what's important to the people out there who balance billing got avoided, but if their premiums go up and it's spread across the workers, then that's not a good strategy. That's the same kind of harm, just from a different direction.
Right.
And so really what the employers would need to do is make sure that they don't just sort of accept the issue and allow the extra money to be paid, but adopt good targeted strategies to handle and respond to the repeat providers, repeat entities, and the bad actors in the
But
system.
Scott, don't forget this, right? If I'm a patient, again, I get like looking at the collective, right? How this is going to affect my entire population of all the workers at that particular company. But if I'm a patient, I'm looking at this going, wow, this is working. This NSA process is working. I'm not me personally. I'm not being balance billed for 7,000. They're not thinking about the fact that, well, that $7,000 is now going to be spread across all the employees and dependents on the plan multiple times. They're not thinking that way. Is that part of the reason why you don't see a large outcry from the insured population in your mind?
Right, you're not seeing outcry from individuals because individuals are not being pinpoint harmed. It's a more dispersed pain, and what we're starting to see, and I think that's what these episodes are going to cover, and hopefully sort of influence or encourage other journalistic activity around is the employers, the self-funded employers themselves. So the question we want to answer is, are the school districts and the police departments and the cities feeling this pain and getting essentially balance billed in these instances? So instead of the bill of the month focusing on a specific individual, like Kaiser Health News did, that sort of thing, what got this conversation started and was all over the papers, the bill of the month now needs to be an employer identifying the cluster of bills that cause them to not hire people or cause their premiums to go up so exponentially that everybody was harmed in these communities. And that's you bring up a really good point. The individual pain is gone, but where we need to go now in the conversation is the data and the expression of the employers and the self-funded plans and what they're dealing with.
So speaking of the data, what the federal data has shown so far is that providers are winning roughly 80 to over 90% of these cases. It's a pretty good winning percentage, and often receiving awards multiple times higher than what they would have received if it was an in-network rate for that particular facility. Why are we seeing arbitrators favor providers up to 90% of the time? And I think I know the answer to this part. What does that mean for employers long term if this does not change?
It's really good that you bring this up. And the sad thing about this is an avoidable harm. So there are a lot of arbitration processes, cost containment processes throughout the nation that have been going on for decades, where they are much more reasonable, much more balanced, but the process itself and the players in the process have really gamed this system. So to talk about that 80, 90% high win rate and to try and at least start to answer, I could talk about this for hours, but to start to answer the question as to what's going on there, three things that I would identify right now is first, a lot of the arguments with these independent dispute resolution entities center around clinical complexity and patient safety. And those are really sort of attractive things for someone who's making a decision. So the evidence itself has gotten thrown a little bit out of balance. And that happened because there was some litigation that threw out the benchmarking evidence that was most important, the QPA and calculations towards the beginning. So complexity, they're talking about clinical stuff when really they should be talking about prices. Next, the baseball style arbitration itself has an anchoring where if someone makes high offers and they win them, then that anchors the negotiation and the dispute resolution at that high point, and there's just not any punishment for making crazy, unreasonable high offers. And then lastly, there are some, we already mentioned this as a theme, repeat players that have really started to understand how to work this system. Private equity backed, repeat players who are gathering together providers and really working these cases, and they are winning, and it is available. That's part of the reason this report is so important, and these kinds of reports is we really need to shine light on what's going on to increase costs and force incredibly high payments for these employers.
So these large private equity-backed groups that you talked about, right? I know there's a couple of examples out there. Radiology Partners, Team Health, and Halo MD I've seen. What advantages do they have, and how does that shape the landscape overall?
Scale changes everything. So what you've got in a nutshell is they've got dedicated teams, they've got standard playbooks and standard IDR offers all ready to go to submit to this. And they feel and act like they are the clients of these IDR entities because they get to initiate the process. So IDR entities even have a tacit incentive to rule in their favor because they're going to get selected more. And these are private for-profit IDR entities that have been certified by the government. So there's an issue there. And then they just have data analytics. And they've taken this and made it into an operational process instead of a last resort. Dispute resolution, going to court, getting into this fight is supposed to be a last resort if something is unreasonable. That's been flipped on its head. It's just a business. It's an operational process. It's not dispute resolution. It is a revenue channel or a collections channel. And frankly, not to get controversial, it feels almost government backed at this point. So it's a real problem. Yep.
So I know that you talk about the high 80s, 90% win percentage that we've seen on the provider side for a variety of reasons. What have been the results with the Phia Group so far? And what's the big differentiator between the Phia Group's results and what you have found and what this report has found nationally?
Right. So the Phia Group helps self-funded plans. We've got a lot of self-funded plans where we are the negotiator for them. So we are getting those disputes in negotiations. and we're doing open negotiations. And then we're also handling the IDR process. So we are the representative who puts together the offers and everything. And so we have thousands of examples of working in that. And the Phia Group, and this is in the public data, the Phia Group's results are really high. And one of the reasons they're really high is because we are not treating this as sort of this reactive dispute resolution. What we're doing is treating this as an important strategic area where you need to look at it as its own thing. And in doing that in negotiations, what we're seeing is some players are just negotiations are a pretext. They're not even responding. So they're not even getting responses in negotiations. And there's no discussion of the evidence that should be the most important, and that is whether or not the payment is reasonable. There just isn't a discussion about that. There's just requests for additional money. And so the negotiations are one piece. And then for IDR, what we're seeing is it's kind of a double-edged sword. You on one side, you're forced into IDR. There isn't enough good eligibility screening, but we have been working very hard when a claim is not eligible for IDR to try and get that recognized and get that claim dismissed before it gets. Eligibility is very important. Second, the review process. We're just not seeing the kind of review, and I think this is because of the baseball style arbitration. It's just it feels like the process has been set up where it's just too easy to pick a number, and picking the provider's number, if you're an IDR entity, appears to be, obviously from the data, really appealing. So that's Phia's involvement with it. We have had the most success in meaningful negotiations based on objective benchmarks and IDR.
So the key thing is what I noticed, what you said was, Phia gets involved and tries to resolve these via negotiation before it hits the IDR process, right? So clearly your report suggests that arbitration is being used as the payment maximization strategy. So
Yep.
what reforms, outside of the Phia Group trying to negotiate in that 30-day window before it gets to the IDR, what possible reforms could change the dynamic so that there is more negotiation and less arbitration?
Yep. Three things. Three things could help change those percentages, those 80 to 90% provider win rates, where I think everyone and anyone who looks at it agrees that's not what was intended here, and it is harmful. And it is ultimately harming workers. But the three things I would say is one, it needs to get back to benchmarks. Two, eligibility, whether or not something even belongs in IDR, needs to be tighter, and the screening needs to be tighter, and then transparency in IDR itself. So in back to benchmarks, we've got these offers, but there's just often an indiscernible connection between the benchmarks, what's reasonable, and what number was selected. And that's because there is, like I said, all these other factors that are clouding it, where they're looking at, well, was this a complex case? What was the acuity of the patient? That sort of thing. But still, with all those factors, if someone gets an award that is above their billed charges, something's wrong there. Something's not working. So back to benchmarks, looking more clearly at benchmarks, requiring a reference to benchmarks that were considered in the IDR decision. Next, eligibility screening. That's really important. You've got to look at what's eligible, whether or not it even belongs in the NSA. There's a lot of these large entities are just filing every claim, and they're getting through because eligibility just isn't being screened well enough. And lastly, the IDR process. We have, to this day, thousands upon thousands of cases, no idea who one single arbitrator was that did these. There's no name at the bottom. There's no credentials. You have no idea who the arbitrator is. That process is completely opaque, and I don't understand why it's being protected, because no name, anonymity, breeds low competency, because there's no accountability. So that's a problem. That is something that would really help. We want to know the names of these arbitrators and who they were. Maybe they'll start taking a closer look at these, and everybody's not just going to win. And also the evidence. We aren't able to see the other side's offer. Unfortunately, that's not considered part of the record, and we're not able to see the evidence they presented that caused the loss. So we don't know who the judge is, and we don't know what evidence was presented. That's a serious process problem. That's what we're really pushing outside of Phia, just to be the tip of the spear to try and get this process improved.
Well, it's pretty obvious, right, that, if you don't have to sign your name to a decision, I'm just thinking to myself, you're not putting as much emphasis on it. It's just, you're not taking it as seriously if you know that whatever you write down, no one's going to ever be able to question you specifically on it. It's amazing to me that would be anonymous. I just think that's shocking. I would think most listeners to this would also consider that to be shocking information, that the person or persons making the decision, you don't actually have a way to find out who they are or why.
Yep.
Amazing.
Yes.
We got time for one last question, okay? And I'm going to basically It's going to be a long one, but I'm sure you can figure out a way to give me a good answer. What steps would you give, or what advice would you give employees, consumers, even with the No Surprises Act in place? And also, in addition to employees and employers, what can the rest of our industry do? What can brokers do? What can employers do? Advisors, consultants? What can we all do right now? What action can we take to change this mess?
The first and best action I'd say is to look at data. You've got to start paying close attention to specifically the data related to your No Surprises Act and arbitration awards. Because as an employer, you're kind of the new person getting balance billed. And so if you look at that data, just like we used to tell patients, you've got to look at your bills. I mean, Adam, you've been saying this for decades. Look at your bills. Look at what's actually going on. You have a responsibility and obligation to do this for your own finances. Looking at data. NSA data, good, solid dispute data is really important. Working with a partner that treats this like something that's not an improvisation. It's not like, oh crap, I got this negotiation. I guess I should negotiate, and now I'm dealing with IDR. Responding to that, like you said, insanity, the same thing over and over again, like you're improvising, get it into a process. Get it into something that's organized, that looks at the data, that understands compliance and cost containment. So you could work with a vendor who does compliance and cost containment and really understands how to handle this process. And then the last and most important thing is to mind those timelines. Really understand what the timelines are and the procedure of it, because a lot of these claims, a large percent of these claims, just simply need to be reviewed as to whether or not they're eligible. Not every single lab is an NSA claim. A lot of labs were at out-of-network facilities. If there's an in-network facility and an out-of-network lab, and somebody reviewed it, that could qualify under the NSA. But that alone, filing on every lab, these private equity groups that are doing that's an issue. So just watching eligibility. Those are the most important things that I would say. And listen to all 5 episodes. You're going to hear a lot more information about it, and we're going to try to help.
Scott, yep. I wish we had the time to actually look at one bill. I think it was Drew Calver's $190,000 bill after his heart attack, which was a big, big claim that got a lot of publicity around this whole thing. We're going to have time to talk about that next time. But any last thoughts, Scott, that will convince all of our listeners to tune in for part 2 of our special 5-part series?
Yeah, the last thoughts are, it's a complex process. There are potential solutions. And the most important one is to keep talking about it, really understand it. And that you mentioned that bill, I think that's a really interesting one to look at. And I think definitely worth tuning in for, because it's the original. It's the OG bill where people started talking about the NSA. So we've got this heart attack, a balance bill. It went through the news. Everybody was talking about it. We're going to take a look at the rest of the story. We're going to say, if that bill had been under the NSA, what would have happened? Would it have helped? And what would the harms have been? And then we're going to look at the parties from that bill. We're going to look at St. David's Medical Center and see what they're doing now. And we're going to look at the school district and see what's going on with the school district. And so that's really going to help, I think, to bring it forward and really get the rest of the story on this billing.
I love this investigative reporting, Scott. It's wonderful. It's great to see that you're not just an attorney. You're not just a, certified software coder. You're not just an AI guy. You're an investigative reporter ready to go on Channel 5 News, man. I think it's wonderful. Scott, by the way, thank you so much. That's all the time we have for today. Folks, tune in 10 a.m., 6 p.m., and 2 a.m. on Healthcare Now Radio. This has been another episode with Health Sense and your host, Adam Russo. And as always, let's go Cleveland Cavaliers. Thank you all.